it takes for an organization to succeed? Because you probably have enough experience where you will say, okay, I feel that could work here, or sometimes you could see an organization where there's a missing piece of the puzzle. So what are these pieces that are critical to succeed with implementing ERAS?
It depends on so many factors. I mean, the anesthesiologists have to be updated in fluid management, new analgesic treatments, etc. The surgeons have to be updated in their care principles with drains, tubes, minimal invasive surgery where appropriate, etc. And it's the same with the nurses, that they must have the knowledge and the realization that ERAS is good for the patients. So it's a complex thing. And that's probably why it takes so long time, because there may always be one profession who is lacking behind the others.
Because some of these protocols are quite complex with many elements to include. Would you say that, do you have a top 3, top 5 things that we should do where we will gain the most benefit, or every single component has to be addressed at the same time?
Well, that's important. If you have to consider too many components, and if the evidence for each of them are not the same, you have to reduce the number of elements. A typical thing is the ERAS programs for colonic resection, where the elements recommended is about 19. But we showed so many years ago that 5 is enough to have a very successful program. That was in colonic. I mean, if we go to a hip and knee replacement, the recovery problems are different, and it's more simple. It's about optimal pain management, patient information, and organization. So it's 3 simple things. The problems there are fewer. I mean, fluid management, different things, is less complicated. So it depends on the procedure.
So for a colonic operation, what would be your top 5 priority that we should all focus on to initiate the program?
First one is patient information, as I repeatedly say. Second thing is the optimal analgesia, and that includes a thoracic epidural in major open procedures, but not in laparoscopic. Nurse interventions with early mobilization and nutrition. Fluid management to avoid hypovolemia, and also to give too much fluid. That's the key elements.
Perfect. Dr. Kellett, I would like to sincerely thank you for being here and to share your insight on ERAS, and to hopefully will help our Canadian teams to move forward with different type of surgeries and different level of implementation they would like to move on during the next few years. So thank you very much for being here.
Thank you for the invitation. I really feel that your approach, with some help from the government side on information, involvement of the patients, etc., that's the right approach, and I'm sure it will facilitate the implementation.
Thank you very much.
You're listening to a demo for StockMusic.net.